Hello, and welcome back to Wellness Wednesday, a monthly series where experts share practical tips and techniques on topics that are important to patients, survivors, and caretakers alike. I'm Erin Kuhn-Krieger with Ralph Pancreatic Cancer Foundation, and I'll be co-moderating tonight's session with Savina Chacheva with our partners, at Cancer Wellness Center. Tonight, we'll be talking with Rosalind Turner, a licensed clinical social worker who will share insights for patients and families who have recently received a cancer diagnosis. For our friends joining us through Cancer Wellness Center, let me share a little bit about Ralph Pancreatic Cancer Foundation. We're a local Chicago organization with connections to some of the leading pancreatic cancer hospitals and organizations in the Midwest and beyond. Ralph provides personal and tailored support to our patients, survivors, and families in crisis by connecting the individuals with medical experts, personalized resources, and education. We create awareness of about risks and symptoms and fund early detection research. Our hands-on approach, or as we like to say, boots on the ground, ensures that no one has to face this alone. So what does it look like? So we personally and directly connect patients and families with the medical experts and specialized resources that are tailored to their specific needs. Ralph funds research because we understand that the best chance of saving lives is through early detection. And we provide ongoing education and support, like our panel tonight, to empower patients and families to make quick decisions confidently. You can learn more at ralphfoundation.org and connect with us through our social channels as well. We'll put our links in the chat for more information and easy access. I also want to take a moment to talk about our annual fall event. Friday night, Lights of Hope hits the Glen Club on November 11th. The Ralph community will come together during World Pancreatic Cancer Awareness Month as we honor loved ones and celebrate those who have gone too soon. We'll have members of Chicago's famed Gold Coast All-Stars rocking the dance floor, signature cocktails, delicious food, auction items, games, and much more. So early bird tickets are already on sale, and we're going to put a link to that in the chat. So go ahead and get your tickets now and keep an eye on our social channels as we head towards it, because we're going to be sharing more details as we get closer. Now, I'd love to welcome my partner tonight, Savina Chacheva from Cancer Wellness Center. Welcome, Savina.
Thank you so much, Erin. As always, it's a pleasure partnering with you and the Ralph Pancreatic Cancer Foundation. Good evening, everyone. Thank you so much for joining us tonight. If you're new to the Cancer Wellness Center, I'd like to take a minute to tell you more about the center and the services that we offer here at the Cancer Wellness Center. So the center is a nonprofit organization aimed to improve the physical and emotional well-being of those diagnosed with cancer and their loved ones. Our services, which currently are both in person at Northbrook and virtual on Zoom, include things like education programs like the one this evening, which aim to help you navigate the varied challenges that come with living with a cancer diagnosis. Wellness classes like yoga, meditation, Tai Chi, stress reduction, and more that provide a holistic approach to healthy living, and support services, which include individual, family, couples, and child counseling, as well as support groups that help patients, their loved ones, as well as those bereaved, manage the mental and emotional impact of a cancer diagnosis. If you would like to learn more about the center and connect to our free programs and services, please visit cancerwellness.org, and the link will be included in the chat. Thank you.
Thanks so much, Savina. We really appreciate being with you tonight. A few housekeeping items as we get started. You could ask questions throughout Roz's presentation tonight in the comment section below. We'll be saving all questions until the end of her program to make sure that we're able to get to everybody. And we realize and want to acknowledge that tonight's topic is a heavy one. And so if you prefer to submit questions via email anonymously, you can do that by emailing us at info@ralphfoundation.org. Tonight, we're grateful to have Rosalind Turner, a licensed clinical social worker with Illness Navigation Resources. Roz received her bachelor's degree in communication from Lake Forest College and her master's degree in social work from Loyola University, Chicago. While her specialization is working with patients and their families dealing with a cancer diagnosis, Roz is passionate about helping all individuals facing medical challenges and more general life stressors and transitions. Welcome back, Roz.
Thank you so much, Erin and Savina. and everyone for having me tonight. And thank you all for being here. As Erin said, I'm a licensed clinical social worker. While I'm also in private practice, I have been in the hospital setting working in oncology as well for the last 7 years. So helping patients, especially newly diagnosed, just navigate where to go, where to turn is definitely a passion of mine. And so I'm very much looking forward to speaking with you all this evening. So recently diagnosed, now what? I'm sure when you first hear you have cancer, your mind kind of goes blank and everything starts flooding in at once. So hopefully this presentation will just help you feel a little bit less alone, have a few more resources than you did before, and just some more places to turn to when you need some answers or some guidance. I like to start with a bit of a disclaimer. I am not a doctor. I am not medical in that way to talk specifically about diagnosis or about any treatment. The role of an oncology social worker is really to be there as support for just kind of the overwhelming emotional and practical side of getting the diagnosis and just the concerns that come with that, and really how to help you just take control, get the information you need, and feel as organized as you can to move forward and what your next steps would be. So it is okay to feel a bit overwhelmed. First and foremost, to validate that it's hard to kind of know what to do. And really, there's no wrong way. There's no right answer of what it is. Everything is, you'll hear a lot that with a cancer diagnosis, it's very individualized. You can know someone who has your diagnosis and maybe has done your treatment, but you respond differently. And that's the same with getting ready towards it. What is right for you is what is right. And so it's hard to kind of remember that. And first and foremost, the most important person on your treatment team is you as the patient, and you and your family who go along with it together. So it's important to remember that and take a deep breath and know that there is a lot of support and resources out there for you to help you every step of the way. So this is just kind of an overview of what we'll discuss tonight, kind of starting with where do you start, kind of the different avenues with that, how to afford it. I know a lot of the initial concerns is, how will this affect my work? How will this affect me being at school? How will this affect me with insurance, or what do I have to pay out of pocket? So hopefully we'll kind of touch base a little bit on that. And then the other factors that this impacts in your life, if you have a significant other, if you have children, if you wanted to plan to have children. So we'll cover a little bit of that, as well as getting support, the different areas of which to do that, and just some tips on how to help you stay organized as you go through this. So again, we probably could have sat here for 8 hours talking about every single resource, which we haven't, but I hope this will be a good start. And you could reach out to the Rolf Foundation, to the Cancer Wellness Foundation, and you'll have my contact info at the end of this presentation to help if there's any additional things that maybe weren't discussed, or please pop those questions in the chat. So where to start? You see your doctor, you got this diagnosis of you have cancer. First and foremost, it's really important to understand your diagnosis. Connects a little bit into the next question about questions for your medical team, but what exactly is your diagnosis? And this is a really important thing of kind of figuring out how little or how much do you want to know. There's no right or wrong answer. You can be someone who wants to know everything. Might be the type of cancer, the location, the stage of it, prognosis, or you might want to know it's this type of cancer, what kind of treatment, and that's really it. And you may want to defer it to another person in your family or a close friend of yours to maybe get a little bit more of the details and to know, to read reports, and that's okay. So as you're getting started and kind of learning about what this is, see what feels comfortable for you specifically. And then you'll be with your medical team. So thinking about the questions to ask, there are so many, and I would have had 10 slides just with them, but I think it's important just to kind of touch over what these questions can include. And in terms of your diagnosis, again, we've talked about what type of cancer, where is it located, what is the stage, how is the staging used to decide your treatments, help if you want to have your pathology report explained to you, if you're asked about genetic testing, asking why genetic testing, or can you have genetic testing, or should other people in your family have genetic testing as well? What tests are you getting done? How do the tests work? What other tests do you need to decide before treatment is done? Um, and then what resources do they recommend in terms of treatment planning? What is the goal of treatment? It's really important to understand what they are thinking and hoping. Uh, what is the combination of drugs you might use or combinations of treatment? Will it be chemotherapy and radiation and surgery, or one, or just two of those? And I think really important is side effects, really, and then the effects on your everyday life. Will your side effects um, cause issues with working, with driving, with childcare? Are there any kind of restrictions you need to do? Or if you're on chemo, any restrictions with being around your family? And then the expected timeline of treatment, understanding, how many weeks, how many months are we looking at? Will I have scans in between these treatments? How will we know if it's working? That's a big question, is what are they hoping to look for? Are there blood markers they're hoping, or scans they're hoping to do? What other lifestyle changes can you be doing? Should you be doing? Do you need to change what you're eating? When should I? And then communication with your team is really important. What is a concern that would bring me to call? How is it best to communicate? Should I call? Should I send a message? Is there someone I should email? When should I do that? So that again is just a tip of the iceberg of all the different questions that you can possibly ask. There are a lot of different lists that I do find online that I kind of help navigate patients to. So I'm happy to share that as a resource. But this it was important to talk about to just kind of get you thinking of what are the kind of questions you'd want to ask your medical team, and the things you'd want to know to kind of, I always say, to give you the best amount of knowledge and make you feel fully prepared and to make the most educated decision on what you want to decide to do with your treatment with your team. Because, like I said before, the most important person of your medical team is you. I put oncology social work here because they are often at the hospital or at your doctor's clinic, and they're just a great resource to go to for the type of things we're going to talk about in the rest of this presentation. Of, you've just got this diagnosis, you've been just told now I have to do this treatment, and I need this resource for work, or this resource for transportation, or I feel like I need some additional emotional support, or how do I help support my family? An oncology social worker is a great resource to kind of help get you started with some of those things, and kind of help with any of the barriers you might be thinking about as you're being told about the kind of treatments you're going to have. And I always like to encourage patients, if they're thinking about a second opinion, that they're really good, not to question what your doctor is telling you by any means, because having a great relationship with your doctor is really important. But hearing another doctor somewhere say, yep, that's the exact plan I would do, just helps to validate, if you need it, to know that you're making the right decision and moving forward with the plan that has been laid out for you. Or you may hear of something that they do a little bit differently, or that they know of, that you can share with an original team you saw, and say, what do you think about this? Is this something to add or do? And again, just equips you with more knowledge and education to make the best decision you can for yourself. And I always do like to talk about a clinical trial. I think that there's a lot of kind of myths or unknowns about clinical trials and what that means. And the world of clinical trials is really changing. A lot of it is using what is considered standard of care treatments now, but adding some things that they are testing that could be a great option for you based on it. So, really asking your team about clinical trials, and if that's something available to you, something to get some more education on. And again, just increasing all the knowledge and options you have around you when you initially get this diagnosis. The next question is also often, how am I going to afford this? You're telling me now I have to come once a week, twice a week. Aside from medical cost, there's parking, there's food I have to eat here, there's just a lot of things. And I kind of want some clarity and answers on that. So, first and foremost, I always encourage to try to get a good faith estimate from your team. They'll be able to tell you where you are in terms of your deductible and any co-insurance and out of pockets you have left with your insurance plan, and then to give you a reasonable estimate of what something may cost if you do have out of pocket costs. Hospitals have really robust billing departments. They have financial advocates and counselors that can help let you know if you qualify for any assistance they may have. A lot of hospitals have financial assistance programs. Depending on where you're going to, it may be based on income. There may be, based on that income, it could be 50%, 100% support. There could be payment plans available to you. So it's important to kind of know this ahead of time before you may start accruing some of these bills and just getting a contact person at the facility where you're going to be receiving your treatment. Next, I would always recommend reaching out to your insurance provider and understanding your benefit plan information, or if that's kind of Medicare, again, having that billing department at that hospital kind of explain to you those pieces of Medicare. And for some of the plans, finding out if you have a health advocate with your insurance. A lot of health plans these days have a nurse case manager, care coordinator that can be available to you and kind of help when billing questions may happen, or, it always happens a billing error or something might be coded incorrectly. So having that support not only from the hospital, but from your insurance provider as well can just kind of help with any of those stresses. And what I tell all patients is, when you get something at home, a bill or an explanation of benefits, and it doesn't look right to you, our first inkling is to just get on the phone right away and call our insurance. And that takes hours and we get really stressed out. Before doing that, go to your medical provider, find out if they have a financial counselor or advocate, bring the paperwork with you, and see if there's someone there that can help you do that to try to lessen that stress. Because, right, first and foremost is getting that treatment and paying attention to how you're physically feeling. And if there are support services like the financial person, like a social worker too, to help you, that's, we want to try to limit that stress before that happens for you. And when you get a cancer diagnosis, ensuring that you have prescription coverage, because there will be prescriptions coming either as supportive care or part of your treatment, and kind of being ahead of the game and ensuring that your plan, or if you have Medicare, a Medicare Part D plan, or Medicaid coverage, to ensure that you'll have prescription coverage is really important. So for those of you who are also working while having your cancer treatment, there are a lot of resources and there's a lot of education and support around this. And so it's really important to learn what is available there for you. First of all, kind of seeing where you are with your own paid time off or your sick time, what you've accrued so far, what you haven't used, and how you're able to use that. And for companies that are larger, the Family Medical Leave Act was put in place to provide this type of support to individuals going through their own medical concern, or if you are a caregiver for someone and just need some additional time off. Family Medical Leave Act, or FMLA, provides individuals that meet certain criteria, including the amount of time you worked for that company and the size of your company, with 12 weeks of job protected unpaid leave. And this can be taken both intermittently, so as needed for appointments, or in a continuous leave, for instance, needing to have a surgery and being off for a certain amount of time. So if this is something you may anticipate needing, it's really important to talk with your HR, and they may direct you to the benefit administrator of your company if they outsource that, to learning exactly what your company offers and getting the paperwork for that, and communicating with your doctor about what your needs are, what you're looking for, so that your doctor can fill out those forms as best to their knowledge, with knowing how the treatment will, how you may respond to treatments. Along with FMLA, a lot of companies have their own short-term disability plans. And so I've seen that this works both ways. Some companies allow you to use the FMLA and the short-term disability separate to kind of have longer time. Others, you combine them in that while you're on your job protected unpaid leave, your short-term disability will provide you that loss of income, oftentimes at a bit of a lower rate, possibly 60 to 70% of your actual income. But again, a great place to be that would either be your employee handbook or manual, or when you were first hired, any paperwork you got, or speaking with someone in your HR department to learn about your company's specific benefits. Now, if something is kind of going on a little bit longer than the FMLA or short-term disability gives you, there's long-term disability. And so this is two different ways for companies that offer that. Again, similarly with the short-term and FMLA, you may be able to go through your company's long-term disability and have that as its own plan. Some companies, if you do transition into their long-term disability, they also have you apply for Social Security disability insurance through the Social Security Administration. And there's a lot of different ways that that works. But again, the best place would be starting with your HR. And if you find that you do need to be applying for Social Security disability, again, non-oncology social worker, or even at some places, maybe a financial advocate works hand in hand to kind of give you information about how to start that application, which could be done online or by calling the Social Security Administration. And kind of understanding that, you know, your income can be based that way. So there's a couple resources that I'm just going to browse through to show you that can kind of help better explain some of those, the FMLA and Social Security disability that I talked about. So this is Triage Cancer, and they kind of cover all things in terms of employment and insurance and kind of a lot of other topics as well. This is a great place, their quick guide. Again, here's all the different topics. So if it was something health insurance related that you had some questions on, comparing, they have some great lists of comparing coverage. If you have Medicare and kind of want to know about Part D plans or enrollment periods that might be changing, or if you were wanting to apply for SSDI, they have some guides to timing of it and how it works and just overall applying. And they also have different topics like estate planning, getting organized with life insurance or any legal assistance. So this is a really great website to kind of help give you more information, and you could always reach out to them as well. So I believe they'll be popping these websites into the chat, or you can, you know, contact us after the fact to get these as well. So I think it's a great resource. And another one is Cancer and Careers. They are solely for those who are working and have a lot of different topics about either if you're looking for work coming out of a diagnosis, or you were in a diagnosis while you were looking. So working on resumes, job and disclosure. When you're there, kind of your legal and financial rights, some of the same things we talked about, short-term disability, FMLA, as well as what to disclose, how to talk with your managers and your coworkers, or if you're working and you're a caregiver, how to be able to balance that as well. So, and one thing I didn't put on my PowerPoint, but I think it's important to mention is something through the ADA, the Americans with Disabilities Act, is called reasonable accommodations. And for those with a cancer diagnosis, you fall under the ADA rules and can also ask your employer for reasonable accommodations. So in the world of COVID, I know a lot, the working from home became so much more of the norm. But prior to COVID, asking to work from home, especially for those jobs that are really computer based, working from home was a reasonable accommodation. Or if it's difficult for you to kind of be walking around an office, a new placement at work that's either closer to the door or closer to where you may park. If kind of with getting chemotherapy, it's kind of hard to focus and you work in, a cubicle shared space. So hearing others calling and talking to people could become a hard distraction. A reasonable accommodation would be getting a desk moved to a quieter place. So I apologize that I didn't put that on my PowerPoint, but reasonable accommodations is also an important thing to talk about with your employer, um, while trying to work with when you have cancer. And then lastly, there are a lot of external financial assistance resources. So if it was help paying for things, or kind of getting help with co-pays, premiums with insurance, things like that. And again, an oncology social worker can help navigate that for you. And we oftentimes have lists or might know of those things. So great resource to ask your provider of these external financial resources. So what else is going on in your life? When cancer happens, that's really the main thing, but there's still all the other things going on that you need to take into consideration. So here's just a couple of the topics, but again, understanding that there are so much more and happy to support and if there's something not mentioned. So for those who are at a place where you are kind of considering fertility, at the time that you get your diagnosis, really understanding from your medical team, and this is one of those questions to ask them is, what is the risks to my fertility? What am I looking at a future state post my treatment? And if preservation is something that is recommended just because of the unknowns, again, there are many options to be able to do that. And there are financial resource options available to kind of help, based on what your insurance coverage may be. So talking with your medical team, understanding what that looks like for you, and then talking with an oncology social worker to help get more information and navigation about how to do that. And then for those of you who are a caregiver or patient going into a cancer diagnosis, be as a couple, that changes the dynamic. Absolutely. And the biggest thing to really talk about from the beginning is communication on how you're both feeling about it, how you both understand it, even communication about, what do you want to do with treatment? How do you want to go about this? Really talking to each other. And they're hard conversations, absolutely. And if they're hard to have alone, that's a great thing to talk to the social worker about. Or if you already are connected with mental health support and have a therapist, to talk about how to best support each other. Because a big thing that happens is the role shift. You, for the longest time, have been partners. And now you're going to this patient caregiver role. And a lot of times it's a difficult transition, understandably, absolutely. And but that doesn't often get talked about because the thing that's kind of right on the surface is the treatment and getting through that and going through all that. But it's important to acknowledge it and make time for not being patient caregiver all the time, but going back to that partner role. And keeping it kind of connected with the communication of what that looks and what your needs are. And with that comes the intimacy. A lot of times it's maybe not talked about, but I think it's really important to bring up with your medical team of, if we're feeling good and we want this to be like, what precautions do we need to have? Do we need to abstain? When do we need to use contraception? Just wanting to, again, this is about the communication and the needs that you both have. So talking with your medical team, understanding that at the beginning so that as it comes up down the road, you're kind of prepared and have that knowledge and education. And for those of you who have families, children, grandchildren, nieces, nephews who are part of your life, they may see some changes with you, with a cancer diagnosis. The physical changes, if hair loss or mobility or weakness, the emotional changes, just kind of being more emotional or kind of noticing that things might be different, there's often, how do I talk to my kids? How do I tell them about this? And there is a ton of support. There are child life specialists through the Cancer Wellness Center, kind of one of their services they have. There are therapists kind of can understand that. There are different communication tools, lists of how to talk with them in deciding what's right for your family. No one knows your family better than you do. And, there's a big push if feeling comfortable to use the words and to talk with them. And there's lots of books that are different topics that oftentimes oncology social workers have of by age too. So it could be age and school grade, kind of make it appropriate for um, where your child is at in their development and kind of making it a family thing to bring together to talk about how this is. And one of the resources I'd like to share is local to the Chicagoland area, is Pickles Group that was recently put together with children. It's a peer support group, children whose parents or primary caregivers or main caregivers going through a cancer diagnosis for kids supporting kids. And it's become a wonderful program. And why I like their website too is they list they have support kits for your family, just information about their programming, but they also list many different organizations like the Cancer Wellness Center here, different camps and other organizations that can help you support your kids and give an outlet for your kids supporting others going through that. So just a great resource. Again, it'll be here and we'll put it in the chat for you to have. But like I said, these are just some of the things that come up when you're kind of first getting diagnosed and thinking about how to support your family. So another really important thing to do when you first get your diagnosis is find out what is the best way that you can support yourself and what are the resources that you need for that support. Cancer Wellness Center, as Savina mentioned at the beginning, is a wonderful place that has such a robust selection of ways you can get support. You can just kind of engage in the education sessions they offer, like something like this tonight. They often have doctors speaking, dietitians speaking for just all the different areas that kind of affect your life while going through a cancer diagnosis. They have individual counseling, couples, family, as well as different support groups that are, it could be group specific, so men, women, young adults, or diagnosis specific. Wellness programs that include, as she mentioned, the yoga, meditation, and Tai Chi, just those activities to kind of really help you cope, help get centered, do some stress reduction, and nutrition support, because diet is such a big part of a cancer diagnosis as well, just feeling good and feeling relaxed. I listed oncology social worker again, because they could be a great support to you and your family when you're at your treatment, not only providing those practical resources, but just being there in the moment when you're hearing news or having emotions to just validate how you're feeling, letting you know that it is a common experience and getting you the resources that you find you need, which is ever changing. You can meet with a social worker at the beginning of your diagnosis when you really don't know what you need, and that's okay and expected. But then as you're going through it and things start to change, you don't have to search for it alone and go down the deep dive into the internet hole by yourself. But your oncology social worker knows these resources and can help get them to you sooner. And a lot of those are the national resources that are just specific to cancer and all different kinds, or diagnosis specific. So there's financial resources, there's resources that just connect you with others that do a lot of programming. Those resources I mentioned earlier, like Triage Cancer and Cancer Careers, they often have webinars, or they're coming back in person of just kind of day-long learnings that is available to patients, so you can get more in-depth information. And then resources specific to where you're being treated. Oftentimes cancer centers do have a psychologist or psychiatrist on staff that you can get an appointment with to help provide you that support, and be there for you. Or if it's just different kinds of things that's specific to where you're being treated, getting support in navigating the different pieces of this that you need to do, kind of going from different treatment, from surgery to chemo, asking your team and your providers really what you need. And lastly, as I mentioned before, getting organized. You are going to be inundated with so much information. And I always say, have a dedicated binder, dedicated notebook to writing down all of your questions. I know mine are usually right as I'm laying down at night, they all pop into my head. And so I've had a piece of paper and pen by my bed so I can write it down really quick and get to go off to sleep. And having a notebook too is also good while you're in treatment to just keep track of how you're feeling, monitoring your symptoms, stuff that's going on with diet, just good to have. And when you're going to your visits, if possible, having someone else with you, because having an extra set of ears is never a bad idea. I always say there's, what they said, what you heard, what they heard, and the actual thing is somewhere in the middle. So a lot of times everyone is catching something else that they might have missed. And if you can't physically bring someone with you, you can always ask your medical team if you can have them on the phone, if you can FaceTime someone into your appointment, just to kind of help you stay organized and make sure you hear everything. And something that I do as an oncology social worker in the hospital setting, talk with every patient about is a healthcare power of attorney, just for the main basis of who in your life do you want us to talk to? If, let's say, you get stung by a bee on your tongue and you can't communicate with us, who knows your wishes and what you want and can help direct us to the best care for what you need if you are unable to speak to us in that moment? So that's nothing about diagnosis or status or anything, mostly to just make sure that your medical team has someone to talk to if we can't talk to you. And talking about that and with your family early on, no matter what, is just important to have. And then that brings me to kind of planning for everything. I know when a cancer diagnosis first comes, your thoughts go everywhere. What about this? What about that? What about this? And there are some really great checklists out there that can kind of help you get organized so that you can check everything off, fold off the paper, put it in the nightstand, and hopefully not have to look at it for a very long time. But then that's not something that you have to constantly be thinking about while you're in treatment. So things that people really don't ever think about, but are your social media passwords written somewhere? Are keys to everything you have, safety deposit box, spare keys to extra cars, a boat, a motorcycle? Are those everywhere? Is all your paperwork in one place? Deeds to your car, deeds to homes. If you have bank accounts or financial investment accounts and savings, is there someone who knows about all the accounts you have or any life insurance policies? Do you have beneficiaries on everything that you've had? Have you even put a will together or talked to someone about what that looks like or where you might want something to go, or written down, I want this, make sure this person has this painting, or I really want to have something donated to a cause I really care about. Just mostly to kind of have that written, have that put somewhere so that you can get organized and put it there and not have to think about it as you continue on, and you could really focus on your treatment, on your family, on the things that mean the most to you, and really kind of get the best out of the situation that is going on at the time. So with that, I know we're gonna open it up to questions, and just be available for anything you need.
Roz, that was really great. I think, to start it off by saying that you need to be you and do you, and that everything is different for every individual, I think is really an important way to set this off. And I think going to your last slide, the organizing piece is good for all of us to do anytime. So I like how that came together. We have a ton of questions coming in, so I want to get to them. So how do I stop loved ones from consulting Dr. Google about my diagnosis, prognosis, treatment? Any thoughts there?
Yes, it's, it's everything. The hard thing is it's all with love, right? Everyone just cares so much. And the hard thing with a cancer diagnosis is that so many people just kind of feel helpless in how to help. So there's a couple of different ways to handle that. If depending on the relationship you have and how to say them, how to speak with them so you won't offend them. So what would be the most helpful is I really need help with X. And that could be groceries or transportation or doing this or finding something that they can focus on instead of going down Dr. Google. Or if that's kind of, I know they're going to do that, saying, oh, that's really great. Thanks. I'll try to mention it to my doctor, or saying, I really feel strongly in my team and then we've kind of talked a little bit about this, but if anything changes, I'll make sure to bring that up with them. So it's validating that your loved one is searching and you have heard from them, because it is very easy to just get frustrated. And sometimes you just got to be you and say, it gets a little overwhelming for me. I need to trust that my team is doing the best right now. And they do say like, it's difficult to get things off the internet, but if we find that we need some more support, I'll be with them about that. So it kind of just depends on the relationship you have with that family, but trying to keep in mind that they're doing it because they love you.
Sure. So what about handling pressure from loved ones who don't agree with somebody's plans or wishes going forward?
Yeah. I think it's understanding why they don't agree. And that would be a great kind of open communication to say, well, why are you worried about what I'm choosing to do? And if you can, a lot of times you could bring that loved one to an appointment with you. You can have a session with the oncology social worker there to talk with both of you about that. Because a lot of times it is helping families understand that the patient is the one going through that. And the patient is the one to decide how much chemo they want, how much radiation they want. And that absolutely is very hard for families sometimes if it is a decision that they maybe don't agree with. And so the medical team can kind of help them understand from the medical team's perspective of why they're supporting this patient and doing it, and kind of understanding how this bigger picture looks. And just giving that support and that time to both people, because it is very hard and very difficult to do, but knowing that those resources and that support is there for both of them and to help mediate that conversation.
That's great. How about, let's kind of flip it. So the next question is, my relative was diagnosed and is refusing help. How do I get them to allow us to help?
Yeah, that is so common, because helping someone in turn is kind of saying, you're losing your independence, that you feel you need it. And sometimes it's really kind of saying, okay, we want to help with this, but I know you don't want help with that. Is there anything we can help? Or could we maybe do this so that you could do that stuff? And kind of trying to more put it on so that it is the patient trying to figure out what they might need help with. Because we all see where we can help someone, but we can't force anybody to accept that. And we can't force anybody to accept their limitations may be. So it's kind of being available at the time when they are ready for help, and trying to find ways to say, okay, well, we won't do that. What can I do? How can I help you? But to be cognizant and understanding that there is a lot of grieving that's going on for all parties involved. And for the patient who maybe you're seeing that I can't help, it takes a while to kind of accept that you may not be at your, baseline anymore, that some things are declining, that you are having limitations. And that's some of the toughest things to accept out of all of it. I'll take the treatment, I'll drive there, I'll do that, but to tell me I can't drive, or to tell me I can't go to the store anymore. And maybe it's not then you doing it, like for someone doing it and say, listen, I won't go for you, but why don't we just call and have groceries delivered just this one time so you can get some extra rest, and then you can keep doing it. Or, finding ways to keep them having some kind of independence and some kind of control over things, because I think a lot of times patients take that as, I'm losing my control. And that's already happened so much with the diagnosis. So it's just kind of finding that, and then maybe having to accept that that person's just not ready for help yet. And that's okay.
Right. And that kind of leads into the next question of, that my loved ones are treating me like I'm a kid. They're treating me with kid gloves, but I'm still me. So I love the idea of, I'll allow you to why don't you do this right now? Because it'll be easier, but next time you can do it. So it's kind of framing it in a way that still gives that control.
Yeah. And it's a great way to communicate with your loved ones, and that, I'm so fortunate that I have people that care and want to take care of me.
Sure.
But let me explain, with cancer, there's so much that's already taken away from me, or so much control I don't have. And these are the things I can do. And my medical team, my social worker are encouraging me to do the things I can do, because there are things I can't. So I promise, when I come across something that I can't do, I will call you. I will let you do this for me. But while I can get up and get my own glass of water or drive to the grocery store, I'm really encouraged to do that. And if you're, and depending on, again, on the relationship with you and your loved one, be like, I think it'd be really helpful if you come and talk with my doctor. We can go and talk with my social worker, and brainstorm how we can best do this, because that often happens. And it's just kind of reframing it for all parties involved, and finding out really kind of why that's happening, or what the concerns are, and kind of helping to mitigate those concerns, so that all people can have like really good quality while they're going through it.
Sure. How about, let's switch to the medical team. So the next question is, what if I feel like my medical team isn't hearing me? When I want to ask questions, I feel like I'm burdening them because they're so busy with others.
Yeah. You are not a burden. Yes, doctors and nurses and the whole medical system is busy. I will say that it's coming out of COVID. It is busy. That just might mean it might take a little bit longer to respond to some messages, to get back to that. Again, if there's ever an emergency, find out if there's a triage line, go right to the ER, but communicating my PR, but you are not a burden. I said this earlier, you are the most important person on your team. And if you're really feeling like you're not being heard in terms of the treatment you want, or things like that, that's kind of where that second opinion might come into play. Doesn't mean you stop getting the treatment you're at, but if you find, it could be another doctor at that same practice, it could be another practice in the area that you live in, but kind of getting that consult and understanding not only it consults when you're meeting medical teams, as much as you're learning about your diagnosis, to also ask them, how do you practice? Will I be seeing you as the doctor, or will I be seeing a PA? Will I be seeing a practice nurse? Who are all phenomenal, but that kind of goes to your style, and kind of learning, well, this is what I want, or this is what I feel I need. But, take that time when you're in that room, and you may feel like you're being rushed, but you need to take it. That is important for you. And you need to ask those questions, and you are not a burden. And if it kind of gets to that point, say to them, I feel like I'm not being heard, and this is what I need. Really look at what do you need, and communicate that is what you need from your team.
Sure. How about, what if I feel too stupid to understand my diagnosis? How do I get people to repeat what's going on in a way that I can understand?
Yeah. I've encouraged people to say just that, to say, could you explain this in a way that I can better understand? Because I'm feeling like it's a little bit overwhelming. Do you have resources that could help me read more about, that's not using medical terms? Is there somewhere I can look and go to, or someone I could talk to who can maybe better explain this in a way? So all of that absolutely exists. And in the moment, don't hesitate to say, can you repeat that? Be like, I'm not sure I understand. I want to make sure we're all on the same page. And you repeat back what you think they're saying, and then they will say, oh no, that's not it, or yes, you've got it. So that, I want to validate that happens every day with almost every patient, myself included, when I go to the doctor for things, because what I've come to learn is that these medical teams are amazing. Your doctors are amazing, but they're doing this all day long. So they may even forget to say words, but they think that they've kind of said it all
Right.
out. because it's just so natural to them. But then when you're in the patient chair, this is the first time you're hearing any of this. So it's almost like they're speaking Japanese, even though it's complete English to you. And then if there are any language barriers, that makes it even more difficult to kind of understand that. So I should say all hospitals have either in-person interpreters or language lines or video interpreters to use. So if you or your loved ones need anything like that, never hesitate to ask your provider for that support as well, because that is absolutely there. But do not feel like you cannot ask questions. That is why they are there, because you need to be fully educated to move forward and consent to what you're going to have. And if they have not done that yet, you need to ask them for more resources, because those resources do exist.
Okay, that's really great to hear, because I think too often, we think, I mean, I'm guilty of it too, being in the doctor's office. Well, they're the doctor and they know, so I shouldn't ask, or I shouldn't say repeat that. But it's really important to get it to a sense of where you need it to be. How about, okay, so this is kind of a two-part question. Okay. So how do I ask someone to help me keep others informed? Having to tell so many people over and over again is hard. I know they care when they ask me for updates, but it's hard. So how do I get someone to step up to be the spokesperson, but also not offend people if I push them off to a spokesperson? So then they gave an example. They said, one of my best friends was diagnosed with breast cancer, and she complains about her family being mean to her because she asks them to check her site. I know there's a lot of sites out there, or to talk to her husband, but they want to hear it from her. So she gets it, but she needs a break.
Yeah. And that's why sites like Caring Bridge, and at one point there was My Lifeline that might have switched. That's why those exist. Or a lot of people do it on Facebook or create an Instagram account. That is kind of where that is. And to starting off with a letter of understanding, like, there's a lot going on. Treatment is really tiring. This is the best way for communication for me. So my need, what I need from all those people who, everybody's saying, how can I help? What can I do? This is the greatest way to help me, is to check this site, or talk to this person about it. And you may have some people that push back on you because personal feelings do get involved. And if there isn't a family member who's really willing to do that, then seeing if there's a friend you trust, or finding out then what does work for you. I always say, you can't pick up every single text, every single cell phone call. You need to be sleeping, or you might need to be working, or you might be at treatment. And do not feel bad or guilty for what you choose to do. And if people don't understand that, you can only control your actions and what you're doing for yourself. You can't control how other people are going to respond to you. And that is really unfortunate, and it is really upsetting. But in your heart, you're not purposely trying, your intent is to not hurt someone's feeling, it's to not be pushing them away. So if someone is taking that back as their intent to you, well, you should be talking to me. We're close enough. Maybe they're not understanding really what is going on with your diagnosis and treatment. And maybe they've never had someone in their life diagnosed with cancer. And so if that is an opportunity to provide that education of, listen, I'm sometimes sleeping 16 hours a day, and it takes every ounce of me just to walk to the bathroom. And so I am not looking at my phone. I can't even turn on my phone. They might not understand it's that in depth, and they might not understand for a while. And that's okay. But at the end of the day, you need to do what is the most important for you and what feels right for you, and not have that guilt or worry of how someone's going to respond to it, because this is your journey and your health and your life.
Right. How about caretakers and the guilt that, the survivor guilt, or the, why them and not me? I know there's a ton of resources, but what do you say to them when they first get the news?
So for the caregiver, I always say it is important to have your outlet, your own source of support, because caregivers, you're spending so much time taking care of your loved one, and that's so great and so wonderful. But if you're not taking care of yourself either, you're going to run into burnout, into these feelings. And I think having your own village, your own network is really good, because you can hear how other caregivers are coping and doing and dealing with it. Or if you're not into that, there is peer support. There's different organizations like Immerman Angels. who help just provide that peer support connection to one. But when you think about kind of that stuff you're worrying about, kind of like the why not me, that worry and those feelings aren't going to help. They're not going to help your loved one feel better. They're not going to help you feel better in caregiving. So how do you reframe that and take that, well, not I can at least do this, or this is what I can do. And it's important too for you to ask that person who you're caring for, what is best, what can you best do for them? Is it driving? Is it making a meal? And is it just sometimes they just want someone to cuddle up with them and watch a movie? I think something I forgot to say that's really important is that having cancer is a part of you. It is not you. And I think that's very easily forgotten, that you could also be a teacher. You can also be a mom. You can be a spouse. You can be an aunt. Those are all the parts of you. And sometimes from our caregivers and from our support networks, we just want to have a conversation that doesn't include the word cancer or include the word treatment. And being able to create that space and those moments, not only for the patient, but for the caregiver and the family as well, just helps you kind of fill up that tank and that motivation and that happiness to kind of continue on with what's going on. And so I think kind of keeping that in perspective and knowing that, there's nothing you can do in that moment to take away the cancer, as much as that is the number one thing we all want to be doing. So we have to look at it as, what can I do? What is in my control? What can I focus on? And when you put that energy and that worry and that concern into those things, that'll help you feel more motivated and driven and just create a better situation for everybody involved.
Sure. It's all such important information. You've covered so many great details here tonight. What if you could summarize or bring it down to 3 key takeaways that you would love for our viewers to walk away with tonight? What would you say?
I think first and foremost, they're all kind of connected. I feel like that always happens. You are not alone. I don't like the word normal, but the feelings you have, the worries, that is so common with individuals going through a cancer diagnosis. And you are not alone. You have such great big teams, be it in the medical field, in with your family and friends, or out there amongst all the resources that are available. There's so much out there. And then that kind of brings me to the second one of resources. There is so much. And I always say to patients, I know you can Google just as well as I can, but that is why oncology social workers exist. That is why there are members on your team who do this, have the resources, know these things to save you that time and energy of looking through it so that you can focus on what's most important. And that's you, and that's your treatment, and that's your family and loved ones, or your hobbies and your activities you love doing. So they're out there. And if you start to worry and stress about it, there's something out there 98% of the time. And then I think the last takeaway is just, which I didn't say, but it's just kind of is to be really kind with yourself and be really forgiving with everything, because I always say this isn't easy. We don't we have biology, we have chemistry, we don't have cancer 101 in high school. This isn't something we learn, and these are the lessons we take with us throughout life. Some of us never, ever have to deal with cancer ourselves or loved ones. For other people, unfortunately, it happens earlier on in life. And then for others, it's much later on in life. And so there's not one experience that is like another. And so be just kind and forgiving. There's no right, there's no wrong. There is just taking it day by day on your journey. And just remembering that and knowing that everybody really has the best intention to help you, and that's what it is. And we may get frustrated at times, and that's okay. But the support is out there.
Speaking of support, where can people find you?
Yes. Oh, I'm sorry.
Where is your I don't know what your jurisdiction is of where you're able to go. I know we're putting in the chat. Okay.
Yep. So there is my information. I am located in Illinois. I am licensed in Illinois. So unfortunately, if you don't live in Illinois, I personally cannot help you, but I can try and find my best to use networks to find people in other states. And so I, at Illness Navigation Resources, I not only do one-on-one therapy, but I also sometimes kind of similarly to this presentation, a new diagnosis and just need, 1 or 2 times visit of kind of doing some navigation. That's, the biggest thing. But this is me, this is my information, or you can contact Rolf if you need anything else.
Well, fantastic. You're doing amazing work out there and are helping so many people. And we're grateful to have you back and look forward to bringing you back once again.
Thank you so much, everybody. Have a wonderful night.
You as well. So thank you to Savina and the Cancer Wellness Center for partnering with us tonight. And thank you for all of these questions. I know, as I mentioned at the beginning, it's a difficult, heavy topic. And I truly appreciate the depth in which people shared their thoughts and candid questions and were able to be there to help themselves, and knowing that their questions are also questions that other people are going to be asking. So if you're catching this on the replay, you can go ahead and write replay in the comments, and we'll be sure to get your questions over to Roz and get those answered to you. And we'll be sharing details about next month's Wellness Wednesday session soon. So be sure to keep an eye out on our social channels. And in the meantime, you could also listen to the past Wellness Wednesday as a podcast. Simply search for Wellness Wednesday or Rolf Foundation on Apple Podcasts, Spotify, or wherever you get your podcasts. And don't forget, tickets for Friday Night Lights of Hope are up and ready. You don't want to miss this one. On behalf of everyone at Rolf Pancreatic Cancer Foundation, Cancer Wellness Center, we really appreciate you joining us tonight and hope that you stay healthy and take good care. Good night.